Good morning, everybody. My name is Panos Moumtzis. I would like to say a warm welcome to all of you listening to today's webinar. The topic of today is going to be about access. How do we make sure that we are delivering assistance to places where most of the desperate needs are? In a minute or two, I'll be asking our panelists to give us their reflections, their practical examples, their field experience on how they have gone about ensuring access while working under very difficult circumstances in high-risk areas. But before presenting the panelists, I would like to speak to you. I would like, first of all, to welcome the many participants, listeners to these webinars who are calling us from all over the world. A particular welcome to colleagues from Asia. I see several who are calling in from Myanmar, Japan, Thailand, and other countries. During the first 45 minutes of the webinar, I'm going to be asking one or two questions to each of the three speakers. During the second 45 minutes, I'm going to be taking your questions that I'd like to encourage you to send us immediately or as the discussion evolves, which I will be asking to the speakers during the second 45 minutes of this live webinar. So, in today's webinar, we're really talking about access. Access is really all about making sure that humanitarian actors are able to reach people in need and deliver what people need. Services such as health support, education, water, shelter, and so on. And to be able to reach them and help them wherever they are, often in difficult situations, in remote places, in places where reaching them is really not easy. At the same time, of course, it's our utmost responsibility to deliver these services without jeopardizing the safety of humanitarian actors, making sure that we're able to stay and deliver and help people where they are. Access is also all about ensuring that people's views, the affected people that we're trying to help, are also taken into consideration. And unless we have this direct face-to-face contact or direct two-way communication, it's difficult to take into account the affected people's point of view. Monitoring is also very much important, and that only happens, or it happens easier, if we're able to have this access to places, to be able to have the direct understanding and review and evaluation and monitor in terms of what is delivered and making sure that the aid reaches the people in the most direct way. Access is also about protection. I think we all agree on the importance of being able to be present, and with our presence to be able to enhance protection by presence, which is also important in terms of our ability to bear witness, to be able to see what's going on, and to be the eyes and ears of the international community in places where human rights violations do take place. And with our presence, of course, to be able to influence, hopefully, a non-deterioration of the situation. To talk about this topic, to answer to your questions on access, we have with us today three distinguished guests who are going to be sharing their own field experience from three different operations, talking from Mali, talking from South Sudan, and also from the Syria context. So first of all, I would like to introduce Sophie Solomon. Sophie works with OCHA Civil Military Coordination Team. She's based in Mali and she's joining us from Bamako. Sophie will be sharing with us the experience of the constraints and solutions that she and her team put together in Mali, ensuring that we have a principled response to the humanitarian operation on the ground, but also practically that we can help reach the people where they are. The second speaker is Lucia Goldsmith. Lucia is joining us from Juba, South Sudan, and Lucia works for the NGO Forum. This is a consortium of NGOs working in South Sudan. Lucia will be sharing with us and talking from Juba her experience in terms of the non-governmental organizations, both international and national, role, support, contribution, experience with regards to the access constraints faced in the South Sudan operation. We all know what a difficult and complex situation it is on the ground, and indeed the work that is undertaken together by UN and NGOs is really important. Finally, I would like to introduce Kevin Kennedy. Kevin is the Regional Humanitarian Coordinator for the whole of Syria approach. He's joining us live from Amman, Jordan, and of course will be sharing with us his reflections on the access challenges to the Syria operation, but also will be talking about his previous multiple assignments where he also had a wealth of experience in terms of access. Moving to our speakers, I'd like to ask all three of them, while responding to the questions, to give us as much practical, bottom-up, from the field experience that I hope will inspire all of you listening in different parts of the world to apply it in your own context, in your own situation. Of course, adapting it to the political security and other country-specific constraints that you have there. I'd like to take the first question to Sophie, who is joining us from Bamako, Mali. Sophie, can you tell us what are the main challenges and the common impediments that you encounter with respect to access in Mali? How have you gone about overcoming them? What are your views?
Good morning, good afternoon, everyone. So let's speak about Mali. So first of all, about the impediments regarding humanitarian access. So since the beginning of the year, we recorded more than 70 access constraints. So here in Mali, it's mainly insecurity and violence against humanitarian personnel, mainly because of the presence of terrorist groups in the operating environment, but we also have presence of IEDs on the road, and of course, we also have all the insecurity in northern Mali. Criminality, the conduct of hostilities, of course, but since the signature of the peace agreement in June 2015, I would say that this access constraint significantly decreased. Of course, we have logistic and meteorological constraints as well, especially during the rainy season. And if you look at Mali, of course, the size of the country, it's, northern Mali, it's the size of two countries in Europe. So, of course, you can imagine that when we have to deliver humanitarian assistance, logistics and a good logistics is essential. Humanitarian actors are regularly victims of carjacking, robberies, and intimidation. And what is really worrying for us is that the level of violence significantly increased over the past few months. So we're working in a very challenging environment, but we're still working. Even though you can see on the map that most of the area are facing humanitarian constraints in terms of access, we have more than 80 organizations working in central and northern Mali and delivering humanitarian assistance. So to do so, as you can imagine, in this context, we have to maintain neutrality, independence, and impartiality to gain and sustain access in this area. So we have a lot of access constraints here in Mali, and since 2012, actually, access is high on the humanitarian agenda. So we have HCT retreat on access, we have workshop on access, but without reaching any concrete outcomes. So as a community, as a humanitarian country team, we decided to establish an HCT working group and strategy on access to really focus on this matter. So in June 2015, we established a HCT access working group, and an HCT access strategy was endorsed. The access working group is composed of NGOs, UN agencies, and donors, and this group has three objectives. The first one is to mainstream access concern within the HCT discussion. The second one is to provide guidance and advice to the HC and the HCT on access matters. And the third one is about the monitoring and the implementation of the HCT access strategy. So indeed, we developed an HCT access strategy focusing on different elements to be sure that we have a work plan to work on access constraints. Before establishing this access strategy, we already worked on access through a guidance note and engagement with armed groups. Because most of the access constraints take place in areas partially or totally controlled by armed groups. So for us, it was really essential that we establish a guidance note and engagement with armed groups. So these guidance notes really focus on the fact that we need to ensure safety and security of humanitarian personnel, free movement of humanitarian personnel and goods, the safe delivery of humanitarian assistance, and so on. And actually, we used these guidance notes as soon as 2014 to participate in peace talks in Algiers to be sure that wording on humanitarian access would be included in the final agreement of the peace accord. And actually, it happened. In June 2015, we had a peace agreement with an article dedicated to humanitarian access and safety and security of humanitarian personnel.
Sophie, thank you very much for that. Now I would like to ask you if you could give us a little bit more details. For example, what are the elements of the strategy that you have in place? What are some of the challenges that you are facing? Give us some more details on how you went about putting in place this strategy.
So yes, this access strategy, it's a general framework for the humanitarian community to work on access. And it's also a work plan from the humanitarian community to really improve access in Mali. So we have three elements. And the third one is about identifying appropriate operational measures to favor humanitarian access in Mali. So we have different kinds of operational measures. We have humanitarian negotiation with armed groups, we have training of the humanitarian community on access, and so on. So actually, three main points: data collection, advocacy, and operationalization. And maybe I would like to develop a bit more about the operationalization of the access strategy. Because as I was mentioning, the HCT provides a general framework on how to gain and sustain access in Mali. But then it's the responsibility of each organization working on the ground to have its appropriation of this access strategy. So common to all actors, I would say that in Mali, we really rely on humanitarian air services to access remote areas. So we have four humanitarian air services here in Mali. We have EcoFlight, we have UNAS, ICRC, and NSF. And it really helps in terms of accessing remote areas, mainly because insecurity is on the road. The second point is for UN agencies, we're relying also on the UN security system, and we have to use armed escort. So to deliver assistance, we have to use armed escort in some areas. Actually, there is a position paper from the humanitarian community saying that we should not use armed escort, but sometimes, unfortunately, we are forced. But when we're looking at NGOs, they are not using armed escort in Mali. They're really based their strategy on acceptance and engagement with the community through transparency about their activity, accountability, and really empowerment of the local community. And I would say also that in northern Mali, working with local partners is really essential because they have the appropriate knowledge of the context. They have a really good awareness of the sensitivity of the population, and they really help us delivering assistance in northern Mali. So these are some examples of the operationalization of the HCT access strategy.
Thanks, Sophie. Can I go back to the point you made a minute ago, which was your second point actually on the access strategy about advocacy? You referred to the advocacy strategy you had to put in place. Can you say a few words about what were the elements of this advocacy strategy?
So actually, there is a communication group of the humanitarian country team, and the idea is really to use media, local media, to encourage the population to be more familiar with humanitarian principle and humanitarian action. So the idea would be to use radio, because this is what we're using here in Mali to spread messages, and really to focus on the humanitarian principle, our mandate, how we want to deliver assistance, and why safety and security of humanitarian personnel is essential and a prerequisite to the delivery of humanitarian assistance. So we're working a lot with the community, and the advocacy strategy targets, first of all, the community, but we're also targeting the government, the military, and the donors. The donor, especially regarding funding of humanitarian air services, funding of training for humanitarian actors, so different kind of strategy in terms of advocacy. The idea is really to have targeted advocacy based on our analysis of the constraints.
Okay, now you've tried your strategy, you put it in place. Can you tell us a few words about what are the lessons learned? What did you learn that you would do differently to hopefully inspire and help other colleagues to apply it in their operation?
So if I'm starting with the lessons learned, I would say that early engagement is essential, and we just noticed that it's really important to mainstream access concern within the whole humanitarian program cycle, and that it should be really included in all aspects of project development. The second one is that we need a coherent and consistent approach from the HCT members. So of course we have our own organizational approach regarding access, but we need to have a coherent and consistent message, and that's why we developed this strategy. That's why we have key messages on access to be sure that we are all on the same line. Of course, also what we notice is that gaining access or maintaining access can only be done on the long term. So it requires the appropriate network. It requires like sustainability in our action. So we need definitely to work on the long term. So these are some of the lessons learned. In terms of challenges, I would say that in Mali, the presence of banditry and terrorist armed groups is one of our main challenges, because we are sharing our operating environment with some actors who are not willing to negotiate with us. So we're really involved in humanitarian negotiation, but then we're facing the limits of our humanitarian negotiation strategy, because they are not the de facto authority, and we have no leverage in terms of negotiation with this group. The other is the multiplicity of armed groups in Mali. We have like more than 20 different armed groups in Mali, in northern Mali only, and it's really challenging for the humanitarian community because we have to multiply our advocacy message. We have to multiply our field visit to these actors to explain humanitarian principle and to explain how they should ensure access to humanitarian actors. One specific challenge here in Mali is the presence of an integrated mission, because actually there's a security provider. In the mandate of MINUSMA, the peacekeeping mission, it's clearly stated that they should provide a safe and secure environment for humanitarian actors. But the peacekeeping force is targeted on a daily basis. So it's really a challenge for us because they cannot provide the security that we're looking for. And finally, I would say the lack of logistical resources. We have an access working group, but we do not have access experts or access people who work on a daily basis on access constraints. So it's more people having double or triple hats working on access. And I do believe that to have like a successful access strategy, we need to have expertise in this area at different levels, operational and strategic levels, and we definitely need dedicated resources in terms of personnel, but also in terms of funds, because we also require some training for humanitarian personnel who has to be on the ground and on a daily basis negotiate their access.
Sophie, thank you very much for that. By the way, I would like to take this opportunity to remind all the participants that they should feel free to type in question in the chat box and send it to me, and I will be asking it to the participants. But also, please use the chat box so you can also talk among yourself throughout the webinar. Sophie, thank you so much for sharing your experience in Mali. That was really very, very interesting. I would like now to move from Bamako to Juba in South Sudan, where we're joined by Lucia Goldsmith. Lucia works for the NGO Consortium platform. Lucia, I'd like to ask you a question on access from an NGO perspective. What is your South Sudan experience?
Good afternoon, everyone. I will start with a very brief overview of the context in which NGOs here in South Sudan operate and some of the challenges that they face in delivery of humanitarian assistance. A conflict has broke out in South Sudan in December 2013, and that has had a disastrous humanitarian consequences. One of the interesting aspects that has significant implications for the delivery of humanitarian assistance is the fact that over 160,000 IDPs sheltered within UN bases. So on UN peacekeeping missions premises where NGOs deliver basic humanitarian assistance, which presents a unique set of challenges for delivery of humanitarian assistance in the context of an integrated mission. Despite all the global obligations that were mentioned earlier by Panos, but also some of the national level agreements made by the government and the opposition, access remains problematic. We operate in a highly insecure environment. NGOs are often victims of criminality, harassment, seizure. NGO premises and clinics, schools have been looted. NGO assets have been seized. We also struggle with road conditions. So a significant portion of the assistance is delivered via air, and we struggle with program interference and bureaucratic impediments imposed by local or national level authorities. There are also a number of internal constraints. One of them relates to what I mentioned about road access, which is very problematic, and particularly during the rainy season, most of the areas where the needs are greatest are only accessible by helicopters. And UNHAS is the only provider in country that has access to helicopters. So NGOs rely on clearances from UNDSS for areas where they need to operate before they're able to intervene, which affects our effectiveness and ability to respond quickly to emerging needs. The other issue would be staff profile and capacity, where we often have staff on the ground who don't necessarily have the right and appropriate tools to navigate some of the dilemmas that they have to deal with on a day-to-day basis. And finally, we struggle with limited reporting. A lot of these issues are so common and so prevalent that many international and national NGOs don't even consider them as an access constraint. They often go unreported, and that limits our ability to collectively engage and address some of these issues. So as you can see, a very challenging environment which has resulted in suspension of activities, withdrawal and relocation of staff, and losses of assets, equipment, and most importantly, staff lives throughout South Sudan in 2015.
Lucia, thank you. You've talked about access, you've talked about planes. Actually, I can hear some background noise. It's a helicopter. I understand actually your office is close to the airstrip. So now I would like to come to the negotiations for access. How do you go about it? Do you negotiate as NGOs separately? Do you negotiate together with the United Nations? How do you fit within the rest of the team, given the fact that the objective and the goal is absolutely the same?
So there are three elements that I will mention. Primarily, of course, access is negotiated directly by individual NGOs or NGO coalitions in specific areas. this engagement with authorities, local armed groups, communities, takes place on a daily basis, and it is important in maintaining the impartial, neutral, and independent character of the humanitarian response in the country. So the majority of these negotiations happen at the field level, at the technical level, and is done by individual or coalitions of NGOs. Here in South Sudan, we also have an access unit within OCHA that at the moment has 4 staff members who deal with a number of important issues. This unit negotiates access issues at the national level and tries to address issues that NGOs aren't able to resolve themselves, either at the local level or at the central level with the government authorities. OCHA's access unit also facilitates requests for use of military civil defense assets, an important function, especially for those agencies who require military escorts. It maintains an access database that tracks access constraints and informs advocacy on access in South Sudan. And then also this unit plays an important role as a liaison with UNDSS on security-related access issues. So we have experienced a number of staff withdrawals and relocations, and this is where OCHA, in coordination with the South Sudan NGO Forum, UNDSS, play a very important role to ensure that staff is able to leave areas that are increasingly becoming more dangerous. And finally, there's the role of the South Sudan NGO Forum. We're a network of around 140 international NGOs that operate in South Sudan, and over 220 local South Sudanese NGOs. So we represent both international and national NGOs. Our role in terms of improving access for NGOs is primarily related to provision of independent analysis of the operating environment, helping NGOs navigate the difficult regulatory environment and address these bureaucratic impediments that NGOs have to deal with at various levels. But also we support NGOs to develop common approaches and positions. And here I will use an example of a situation that NGOs were facing in 2015, and together we managed to address it. It was a situation where NGOs were faced with a number of requests, initially very polite, as the situation progressed, very, very challenging from local authorities who were demanding that local government officials be accommodated on NGO compounds in areas where there was no other alternative accommodation. It was really important that NGOs maintained a united position, and that we were able to address it collectively, because once NGO practice has very significant implications for other NGOs in that area. So we were able to get these NGOs together. After lengthy discussions, we arrived at a common position that we then presented to the authorities, first at the local level and then escalated it to the national level, and explained why we weren't able to accommodate these types of requests. We explained the principles that we have to follow and how we operate in areas, and how this would affect our ability to deliver impartial and neutral assistance in other parts of the country, and that was successful, and we have seen a limited number of these requests following this discussion. Another example would be when we worked together with the OCHA's Access Unit in trying to address some of the access issues in the opposition environment, in the opposition controlled areas. As the conflict progressed, the opposition has set up structures in areas under their control, and they have come up with a number of ways to regulate NGO operations in that area. Some of them we were able to comply with, but a lot of them said that just registration, taxation, cross-border assistance, and other requirements were posing serious difficulties for NGOs to deliver effective response response in areas under opposition control, to the point that many NGOs really struggled to operate in a large part of the country. So the OCHA's Access Unit and the NGO Forum met with the opposition authorities, and over a period of 2 days, with the authorities at the local level, but also the senior leadership of the opposition, engaged in a discussion where, again, we discussed the principles that we follow and that bind our operations, and agreed on what was acceptable, and came up with a resolution that was very helpful for individual NGOs to use. It outlined a number of commitments that the opposition authorities agreed to, and were then consequently used by individual NGOs at the local level, where a local official was being unreasonable or was trying to extort money from NGOs. So that worked very well.
Thank you very much for that. So if you could tell us what are the challenges, and more importantly, what action did you take in order to overcome them and move forward with ensuring a better access?
So there's a number of recommendations that go back to some of the challenges that I mentioned earlier. A very important one is the commitment from the humanitarian leadership to support access negotiations at the national level to deliver, to ensure principled humanitarian action. Another one relates to the comments I made about access to independent air assets. So it is something that we're going to look into in more detail in 2016 to see how NGOs could have better access to independent air assets, so they're able to be more flexible in their response. Another recommendation would relate to issues around reporting. As I mentioned, we can only advocate and address issues that we are aware of, and we need to have a solid evidence base to use in these negotiations, and that's where it is very important to encourage NGOs to develop internal access reporting mechanisms, and also review existing mechanisms that we have in country to ensure that they are meeting the needs of the humanitarian community. And then finally, going back to the capacity of the staff in the field and their ability to address these often very, very difficult and very challenging situations. And that is something where the NGO Forum and the Access Unit are working together to develop field-friendly practical tools that can be disseminated to the staff in the field that will help them better understand humanitarian principles and provide them with tools that they can use in their day-to-day interactions with local authorities and armed groups.
Thank you very much for that. I'd like us to now move to Amman, Jordan, where we're joined by Kevin Kennedy, the Regional Humanitarian Coordinator for the Whole of Syria approach. Kevin, I would like to ask you if you could bring from your own experience your approach and methodology in terms of ensuring access, in particular for the Syria response. As we all know, it's a very complex, very, very really difficult and challenging. What are your steps? How do you go about bringing the cross-border operation, whether it's from Jordan, from Turkey, from Iraq? If you could give us your insights and the approach you have taken.
Thank you, everybody, and good afternoon, or good morning, as the case might be. And this is a great opportunity to discuss an extremely important subject. I just returned from Damascus last night, was up there with the head of OCHA, Mr. O'Brien, for several days. And maybe just a couple basic facts, I think, about the situation, the context in Syria. Firstly, it's a war zone. It's a very active war zone. While there are areas in the country that are relatively quiet, throughout much of Syria, and particularly where their needs are most acute, there's bombing, shellings, mortars, katyushas, sniping, firefights, tanks, RPGs, etc. We count 85 humanitarian workers who have lost their lives. Actually, it's probably more than that. Over 700 medical professionals have lost their lives. We don't have a very good system for keeping track of it because it's such a wide-ranging operation over many countries, but it's indicative of the toll this has taken. I think, secondly, it's also getting more violent with the entry of Russia into the war on the ground here in the last 2 months or so. increased aerial bombardment, more accurate aerial bombardment, and areas getting bombed that were not bombed before. It's causing us problems. Third, it's a complex operation, and depending where you work, you obviously have different challenges. It's a huge operation inside Syria, Damascus, Tartus, Latakia, Homs, Aleppo, but also outside from southern Turkey, from Jordan, from Iraq, and from Lebanon. We have about 400 organizations working in different modes, trying to meet the needs of the Syrian people. What works, Panos, your question? I mean, a couple things, I guess, small and large, practical and more philosophical, I guess. One is, of course, talk to everyone. We are deeply engaged with the government of Syria, not the easiest government to work with on many occasions, but we discuss access with them, I would say, on really a daily basis. This is important. We get some cooperation, and sometimes we do not get cooperation. Secondly, is to take advantage of changes in the political process or in local dynamics. There have been a number of so-called local ceasefires in Syria. Some negotiated among the localities themselves, some negotiated by outside actors. A couple of weeks ago in a place called Zabadani near the Lebanese border, and Kafraya and Fua, which is a bit north in the northern part of the country. But most recently in Homs, in fact, I was able to observe part of this past weekend, where an area in the city of Homs, which has been besieged essentially for 2.5 years with very limited humanitarian access, in a deal to move fighters out of there who were not agreeing to go along with the ceasefire and the UN helped move them. We were also able to deliver a substantial amount of assistance in several different convoys to meet the needs of the 75,000 people. And so there are these local ceasefires, and we try to sort of leverage them to create access, because the ceasefires are normally obviously in areas where there has been a lot of fighting or shooting, or the areas are so-called besieged or hard to reach. On that score, about 40%, 35% of the people in Syria, we estimate, are in so-called hard-to-reach areas, which means you have very intermittent humanitarian access, or actually besieged areas, which is almost none or no humanitarian access. These are issues we constantly work on. One way to do that is our cross-line convoys. These are interagency convoys going from government areas to non-government areas. And I think here you see ways to create access. Once you get the green light from the government, once the security situation is satisfactory, which often it is not, we do the negotiations to move from government to non-government areas. And as I mentioned earlier this morning, it often involves talking to as many as 10 or a dozen rebel commanders, commanding units of different sizes, ranging from dozens up to thousands, to ensure that we have safe access through the areas, the pieces of territory that they control. And this, I think, is something maybe used elsewhere, but we have used Skype extensively, and now WhatsApp extensively. In Skype, our OCHA staff, our DSS staff, and some people from the Mastura's office do the Skyping with the various commanders to make sure we have a green light and safe and secure transit through their territory. In the Homs operation over the last weekend and last week, all that coordination on the ground between the people inside, the people leaving, people wanting to stay, the government, the governor, et cetera, was all done on WhatsApp throughout the course of the night to bring things together. As you might imagine, an operation like this, there were a couple logistics hiccups. Some agencies failed to provide the buses, so we had to scramble and got buses, and credit to Mr. Hillo, the humanitarian coordinator, who did that, but it was all done on WhatsApp, so it's quite interesting. I think also on a larger scale, and maybe I'll stop here and go back on some things, Panos, and shorten my presentation, is all cross-border operations. And you can turn, there's a slide there called Catchment Areas of Cross-Border Modality. You see it, very fancy title. Essentially, NGOs, international, national, have been operating cross-border from Turkey and from Jordan, particularly from Turkey, for several years, 3 or 4 years. It was only last summer, during 2014, that the United Nations joined in this effort. This was a very contentious issue with the government of Syria. It required high-level political discussion and negotiation, but eventually the resolution was passed, it was repassed, and it's up for renewal this month. I believe it will be renewed. And it allows us access into areas of the country, largely not controlled by the government, that we are able to ship in supplies either directly by the UN or through our implementing partners. This leads to, to have access to what? Well, you need to know what's going on, and you need to have reliable partners on the ground. I won't go into our humanitarian needs overview, except to say I think it's probably one of the best ever done, and that was conducted in a war zone is quite extraordinary. And it has given us, for the first time in 5 years, I believe, a good grip on the needs and requirements of Syria. But also the use of the local actors, so the local NGOs, really. And this is, I think, a positive feature of this crisis. As I said earlier, Panos, this morning, in most of my experience in emergencies, national NGOs are given a short shrift. They're treated as the junior varsity B team NGOs, and not really supported, do not receive the resources, the training, the cooperation. In our whole Syria exercise, national NGOs from both outside and inside sit on our policy board, the senior level board, our steering group, are consulted regularly, are brought into the picture. They're the ones who do most of the delivery in northern Syria and in Dara in southern Syria. They're the ones who suffer the casualties and are most at risk, and we have found them to be really good partners. They're all new to the business, if you will. Mostly in the last 2 or 3 years have been formed up, but they're quick learners and very good people. So this has been something that we use and has made a difference. And lastly, I'll stop and go back to your questions, and I think this is important, and Lucia sort of touched on this as well as one of your documents. One other positive development in this Syria operation is, in fact, at least from a UN perspective, is that we are still on the ground. Despite all the shooting and the mortars, we have over 200 international staff on the ground, about 1,200 national staff, and they stay despite all the violence that occurs around them. Okay, when we were in Damascus on Sunday, I think I counted 50 mortar rounds landing in downtown Damascus as we went about our business, and this is a fairly common occurrence in Syria. Not quite as much as it used to be in Damascus, but it's still there.
Kevin, thank you so much for the examples you have given, coming from the richness of your experience. One of the questions we got from the attendees to this webinar is, how do you go about use of armed escorts when delivering humanitarian assistance and trying to help people in need? As you know, there are different views on that. What's your advice? What's the pros and cons, and how should colleagues listening around the world go about use of military escorts?
Thank you very much for this. You're right. This is a question that at least I've had to deal with for like 25 years now. And in Syria, to be precise, we do not use armed escorts. And the government, however, will come with us as far as, say, on a cross-line operation. They'll come with us as far as the end of their reach and then stay off there. Sort of low-key, usually, people in civilian clothes, different kinds of cars. It's not the classic tanks and armored personnel carriers trucking down the road with you. I think on a larger scale, obviously, we would prefer not to use armed escorts. And all these contexts are different in different countries. And I realize some integrated missions, so-called, require the use of armed escorts for the safety and security of the staff. I think it's a last alternative. But I also think sometimes, you have to weigh what's the greater good here or the greater harm. If that's the only way to deliver assistance, and we believe that the people are truly in need, in serious need, would it be wise to use it? I think in some cases, yes. In some cases, no. I think it requires an analysis of the factors. It requires analysis of how one is configured. I've always thought that, within UN, so you're in a peacekeeping mission. They have a black UN on the side of the car. We on the humanitarians have a blue UN on the side of the car. Does the average 18-year-old sniper in Eastern Congo really know the difference between those two, as if one's good UN and one's a bad UN? I really doubt it in most cases, okay? So I think some of these concerns I don't think it would hold water. But by and large, I think we should avoid the armed escorts. If we think going with them, even deliver urgent needed assistance, is going to ruin things for future. This is taken into account. But all these situations require analysis. I would be against a hard and fast rule not to use military escorts. Over to you.
Thank you, Kevin. I'd like now to take us to Bamako, where I have a question for Sophie, which is sent to us to me by one of the attendees to this webinar. Sophie, the question is about data collection. How do you go about analyzing, first of all, collecting the data, measuring and analyzing in a way that you can help you to use this analysis to take the right decision in terms of access? If you can elaborate a little bit further on this data collection and analysis.
Thank you, Panos, for the question. So regarding the access monitoring and reporting framework, actually it's a tool which is used by OCHA in different contexts, in Yemen, in Pakistan, in Afghanistan, and I'm not sure, but probably also on the Syrian crisis. So basically, when we're coming to data collection, it's about a comprehensive database of all access constraints. And we're trying to investigate on these access constraints. So if we hear about an incident in northern Mali, we'll call the NGO, we'll try to have more information about the event itself, the responsible actors, the impact in terms of delays, or in terms of relocation of staff, and so on. So we're doing that on a daily basis, collecting all the information that we're receiving from the field, mainly from our colleagues operating in northern and central Mali. Of course, it requires good collaboration with the NGO community and with all actors present in northern Mali. And this is where sometimes it is really sensitive, because some NGOs, some partners are reluctant to share information, maybe thinking that it could be perceived as providing intelligence or providing information to the UN. Which is also in a peacekeeping mission could be very sensitive, because MINUSMA, the peacekeeping force here, is perceived as party to the conflict. So you see, it could be really sensitive in terms of data collection. So actually, sometimes we can have data collection without, of course, quoting the name of the NGO, so that there is no reference to a specific NGO. But at least we do have the information. And with this information, we can really measure access constraints here in Mali and really target our message in terms of advocacy, because we would know who are the responsible actors, where does access constraint take place, and so on. So it's really essential for all the access strategy here in Mali.
Sophie, thank you very much for that. I'd like now to take a question we have received from actually a couple of attendees that is similar, and I would like to ask both Lucia and Kevin to reflect your thoughts. And the question is about the role of the national NGOs, the national colleagues, with regards to access. How do we go about making the most out of their capacity at the same time, without really making sure that we're overexposing them and putting their lives into unnecessary risk? Obviously, the national NGOs, people from the area know best in terms of what the constraints, what the issues are. At the same time, often in a conflict, they may be seen appearing of having taken one or another side. So how do we balance this advantages on the one hand, but also constraints in order to really maximize the role of the national NGOs and, of course, to be able to reach the people in the best possible way?
Thanks for the question, Panos. It's a really important question. In the context of the response in South Sudan, national NGOs play a very important role. As I mentioned, the NGO Forum has over 220 national NGO members, but there's many more community-based organizations and other types of organizations that have been providing assistance to local communities throughout this crisis. I think it is important to remember that our national colleagues often experience these access constraints in a different way. We are getting reports from national NGOs and also national staff of international NGOs who are being routinely harassed and beaten up when they're trying to deliver cross-line assistance. So NGOs have to be very careful about which ethnicity their staff belong to, where is it safe for them to go and safe to operate, which poses additional constraints on the NGO community to effectively deliver assistance. The other point is related to what you mentioned, the suspicions that the conflict parties often have towards some of these national NGOs. Here in South Sudan, we had several cases this year where directors of national NGOs that have been providing cross-line assistance were harassed and detained, imprisoned by the national security military intelligence and questioned about the health and education wash activities that they have been providing for the communities on the other side of the conflict. So it is a very difficult environment, and I think here the role of NGO networks such as the NGO Forum and the role of the OCHA's Access Unit is critical. We are often able to address some of these issues, to discuss these issues with authorities at the national level and the local level, and provide a layer of protection for the national colleagues on the ground. Often it is very difficult for them to push back and have some of these difficult conversations with local authorities because they live in those areas, they have relatives in those areas, and are worried about the consequences of those discussions. So this is where the role of the NGO Forum and the Access Unit is critical. Over to you, Panos.
Thanks, Lucia, for your insights. I'd like now to take the same question to Kevin and hear his thoughts about the role of national NGOs.
Sure, Panos, thank you. And I agree with Lucia, it's a very important topic, and particularly in this operation. Without national NGOs in Syria, we would be dead in the water in most parts of the country, in many parts of the country. They are, I think, viewed in some quarters as agents for one side or another, or terrorists or something. They are concerned about their security. Many of their facilities have been bombed, intentionally or not, it's hard to say. And they, in past, they're very reluctant to even share the names of their organizations in a response plan. This year we've actually been able to put most of them in there, but still they take a number of measures where they really do not want to be skylined or highlighted what they're doing, because they are perceived by some as being on the wrong side or taking sides. So security is a big issue. One thing, it's a small thing, but actually it's not. It's just another. I had nothing to do with this. Some bright people in Turkey thought this up. They invested in a simultaneous translation system. Of course, our national NGOs are all Arabic speakers. We have a relative handful of Arabic speakers among our international staff. I've been in many crises where, frankly, the national NGOs don't come to meetings because they can't understand what's being said, and people don't speak the local language. I would actually recommend this for all crises, that the simultaneous translation should be there. It brings people together, and you can have meetings. In fact, all our meetings in Turkey and are all done in two languages simultaneously, which really makes a huge, huge difference. We're facing a challenge now, and Sophie would appreciate this, with deconfliction. We're working well with the Russian Federation on deconflicting humanitarian operations from airstrikes. However, many of the NGOs operating from Turkey do not wish to be involved in this and take the risk because they're reluctant to share their information on locations, whereabouts, operations, for fear that will end up in the hands of the government of Syria, and rightfully or wrongfully, they believe that they could end up being targeted or give information away. Now, in this area, and I think in other areas of the world, there really are no secrets. Communications are monitored closely by one or more parties to the conflict, emails, phone calls, etc. So I'm not sure that they're really hiding information from anybody, but maybe perhaps some. But there's that perception, and it's created for us a bit of a dilemma as to what to do, and we're working on that. Over to you, sir.
Thanks, Kevin and Lucia, for sharing your thoughts on the national actors. I was actually last week in Yemen, where also the question of national actors came, and that was also in particular with regards to deconflicting. and really maintaining the neutrality while at the same time making sure that we're able to deliver and help people in all sides of the conflict. Sophie, one of our webinar participants had the question, and the question is, if you had the resources in hand, if you had all the money that you needed to put in place the perfect, ideal access team or access strategy, what would that look like?
Thank you, Panos, for the question. So in a perfect world, I would say, if we can have such a team, I would say it would be composed of different kind of background. The first one, I think we need someone dedicated to policy, because we need to have a general framework when it comes to access. So I think it's really important to have this HCT policy. We spoke about the access strategy. There is the engagement with armed group, but we also have position paper on interaction with military actors. So I think policy is key to have this general framework for the people to engage in access. I would say also, we spoke about deconfliction with Kevin just a few minutes ago, and I think civil military coordination is also essential when it comes to negotiate access. Then we need also, of course, regarding data collection, infographic, I think this is really essential, because to have informed decisions, we need to have this information. And I think having all the maps that, for example, we saw from the Syrian crisis is really essential to capture where are the main constraints and how we should work on that. And of course, I think we should also have someone dedicated to operation. How at operational level, at programmatic level, we can just take into account the access constraints. So maybe through innovation, the use of voucher, the use of smartphone for a humanitarian project. And this team, composed of policy, composed of people dedicated to operation and program, civil military coordination, data collection, and information management, could support the HC and the HCT in tackling humanitarian constraints in a specific country. So, of course, I think it's in an ideal world. I think, of course, everybody can contribute to an access working group, and this is what's happening here in Mali. Everybody from the donors to NGOs to UN agencies, they contribute with their own background, their own expertise to this access working group. So it's definitely the responsibility of everybody. But of course, if we could have these amazing teams to deal with access constraints and to gain and maintain access to this space.
Sophie, thank you very much for that. Lucia, one of the attendees to this webinar sent us a question saying, how can the NGOs, both international and national, contribute as part of an HCT when they sit in this humanitarian country team senior management body? How can they contribute to more effective access strategy? What is it that the NGOs can concretely and specifically bring to the table that would enhance the strategy and the approach?
There's a number of ways in which NGOs contribute to HCT's access strategy. We have a good representation on the HCT of both international NGOs and South Sudanese NGOs who bring their unique perspective into the development of the access strategy. NGOs tend to have more longer-term presence in many of the deep field locations where UN is not present, and they experience a number of access constraints that other colleagues, other humanitarian agencies may not be aware of or may not experience to such an extent. I think one of the key category would be in relation to bureaucratic impediments. NGOs tend to deal with a lot more issues around interference with programs and employment policies and taxation, registration requirements, etc. So it is very important that NGOs are well represented at the HCT and that they are able to bring this unique experience into the overall access strategy, so we can ensure that we are able to collectively address these issues as they come up at the national level, but also at the local levels. So that's where the NGO's input comes in primarily. Just like in Mali, here in South Sudan, we also have an access working group which is a group of a number of active NGOs and UN agencies where we share experiences, where we share analysis and discuss emerging trends and collectively design ways in which we can address some of these challenges. So these would be some of the examples from South Sudan. Over to you.
We have actually a spicy question. One of our webinar attendees sent a question asking about the role of the resident coordinator and humanitarian coordinator, to what extent there is possibly a conflict on approach and methodology. So the question we received says the resident coordinator's role and job is to support the government. He or she sits in the capital and they do everything possible to support the government. Now, in conflict situation where you may also have non-government actors on the ground, the job of the humanitarian coordinator, the second hat that the same person wears, is to talk to everybody, government but also non-government actors, to talk to the opposition, to talk to rebel groups, to talk to people who, of course, the government will not be happy with that approach. So how can one person reconcile these two roles and approaches that are opposingly different in terms of how the way we go about ensuring access and helping the people who are in need on either side or both sides of the conflict?
I think that it is true to a certain extent in South Sudan. Obviously, both UN agencies and NGOs, international NGOs and national NGOs alike, need to ensure safety and security of their staff. They need to make sure that situations that they're sending them to are not going to result in loss of life. So to a certain extent, it remains a contentious issue in South Sudan. As I mentioned earlier, NGOs heavily rely on UN air assets in South Sudan, and that comes with security risk assessments that are conducted by UNDSS. Although in theory, NGOs do not need to follow the advice of UNDSS, in practice it's very difficult not to when your only option to get to a certain location is a UNHAS air asset. So that's where some of the challenges come in. But we have had a number of discussions with the colleagues from DSS here in Juba, OCHA and others to make sure that these security risk assessments become more flexible, more relevant to the changing context on the ground. But it still remains an issue for NGOs' ability to react quickly to changing circumstances on the ground.
I'd like now to take the same question to Kevin.
We have 200 staff on the ground in Syria in a very active war zone, maybe the most active of the world, with multiple planes flying and dropping bombs, and we're still there and working. I think that says that we're becoming less risk averse. I would agree. There are some security officers who have probably not fully taken on board the whole role of to enable operations to make things happen. I think it's change that's taking place, a cultural change within the security world. I think it's heading in the right direction. I mentioned earlier, without going into great detail in the first round of this webinar, that after the Benghazi incident, the United States had an investigation into Benghazi, but also sent a team around private sector and public sector looking for best practices on security. When they came to us, I thought, well, could we tell them they have a $4 billion a year security budget in the State Department, U.S. State Department. Our budget, when I was there until last year, was $256 million, okay? And also working more exposed. They left there, they were actually, to be honest, they're blown away. Our risk assessment methodology, which was put in place a couple years ago to replace all the former stuff, the guy there, the former head of the U.S. Secret Service, said the best he's ever seen. And in fact, we've been giving classes now in the U.S. Foreign Service Institute how we do that. Canada had the same response when they came to see us. We've also been working up in Canada, at least when I was there. I would agree. Some are not. A couple of the problems and maybe ways to overcome this. One is, of course, is the lack of sharing information. I think Lucia touched on this before. And in fact, I also think of Sophie's in Mali. I was in Mali 2 years ago. We had a very good DSS security analyst, very informed, knew the picture, knew the players, knew the country. and he shared with all the NGOs on a regular basis. He received very little in return. Really little in return, and it was a major problem because there were people out there, the UN was not in many of these locations, and it was just not getting the information. I had a similar situation, people report back to me from Afghanistan, where the NGO Forum share information was, 97% UN and 3% NGO. I'm just putting this out there because I think this is a problem. I think another thing that's important that enables, I think, to bring some of the security officers on board this is to be clear and open about what you're trying to accomplish, what your program is actually doing, okay? And they need to know more. They need to understand so they can design the security from the inside out rather than the outside in. And lastly, and this is it only happens in a couple of occasions, but it certainly happened in CAR about 2 years ago, where the reluctance, in this case it was the UN agencies, the reluctance of UN agencies to move beyond the capital, blaming security restrictions. And I recall this because it bothered me, and I looked into it deeply. And created a map of all the locations in the Central African Republic. The date of the security clearance was given to go, and we had, I think, 2 international staff beyond Bangui, and most locations it was 6 months on, and no one had returned there. So it often is, I would do this except that this guy's stopping me, and sometimes it's a convenient stop. But I do agree with you. There are some cases where people have not really fully come on board with this, but I believe it's the trend. It will happen, and I think this is where a good humanitarian coordinator, he or she, has to step in and sort it out.